All right, what's up? It's MRI Man coming back to you once again. Today we're doing a video on the MRI patient screening form, which is very important. MRI safety is always number one. So if you're a student or if you're a newer tech, this is a great video for you. And today, of course, I got Gabby. She's my wife, and she's been doing this for about a year, and I've been in the game for about going on 4 years. And as you know, I drop videos every Thursday and Friday. I answer all your questions. I've been doing this since 2017. So if you haven't already, if you're new here, like, subscribe, leave the comments below. But yeah, introducing, of course, as always, my beautiful wife and Gabby. Introduce yourself a little bit, and then we're gonna get right into the forms. We always get right to it. Here we
Hi,
go.
everyone. So, yeah, my name is Gabby, and I am excited to do this video today because we are going to go over a safety screening form, which, if you are, looking into becoming an MRI tech, or if you're, looking into becoming a patient screening aid, then you're definitely going to want to know how to screen the patients properly because patient safety is number one.
All right, so Gabby, let's get into it. Let's just break down this form, which is gonna be seen across the board, and we're at this website www.mrisafety.com. Sherlock, which is he's all about MRI safety, right? This guy's like the legend in MRI
Mm-hmm.
safety, and as you know, MRI safety hasn't been out forever, right? It just started. I'm not sure when is it, in the 2000s or something like that. Not that long. It hasn't been that long. Anyway, we're gonna get into this. Gabby, yeah. So like, break down this form. This is something you guys gonna be seeing like every day, right? Okay.
Yeah. So the first part of the form is just your basic patient information: name, date of birth, height, weight. You need those actually for running your scans. Height and weight are important.
And let me
Um,
stop you with the weight. Also, you got to know the weight because sometimes you're going to be giving them the contrast, right? Based on the weight is how much contrast you're going to be giving the patient. And also, the MRI tables, they have a weight limit. So weight is actually important, right, Gabby? Height and weight.
yeah.
You can keep going.
All right. So after you've got your patient's basic information, you need to know why they're getting that MRI done. So, what happened? Why did the doctor send them over to you? Usually, an injury, and you want to know their symptoms and how long they've been going on. Always check your referring doctor. Your referring doctor has to match what you've got because you don't want the patient information going to the wrong place. And then we're going to move on to the actual screening portion, which will be surgery, what kind of surgery they had. Surgery is important, especially if they've had surgery in that area that you're looking at, because if they have had surgery and there's metal in there, then you're going to want to know how to image that area well, being, metal in there. So you are going to ask them how long ago they had that surgery also, because that's also important. And after that, you're going to want to know what kind of imaging they've had. You want to see also if you've done prior imaging on that patient. You can go back, look at it, and compare. You want to make sure that you get something that looks the same because, especially if they've had an MRI already, you want to make sure that your MRI matches that MRI so that the radiologist can compare. And then we're going to move on to previous MRI reactions, like reactions to metal or any abnormal reaction to their prior MRI.
Oh, Gabby, can I pause you for a second?
Mm-hmm.
Yeah. So when you're getting their priors, you want to make sure to ask them: was that a CT? Was that an X-ray? Was that an ultrasound? Was it a PET scan? Just something that the doctors want to know, because you can just put priors at so and so hospital, and they're gonna be like, well, was it an X-ray? Was it an MRI? I was just gonna throw that in there. You can get back to it. You're on number 3 right there, or go ahead.
So Number 3 is, have you experienced a problem related to MRI? And some people, according to ACR, some people do experience dizziness, nausea, and peripheral nerve stimulation just from the MRI itself. And so I guess that's an important question to ask because of that. And then number 4 is asking if the patients had metal go into their eyes. And this happens actually pretty often. And that is why we ask this every single time that a patient comes in, even if they have already had x-rays of their orbits to clear them for an MRI in the past. We have to keep asking them every single time because some people work with metal and they will continue to get metal in their eyes, or they think they do. And so you will have to do an x-ray to make sure. And do you want to take number 5?
Yeah, number 5. Have you ever been injured by a metallic object or a foreign body? For example, BB, bullet, shrapnel. If yes, please describe. I'll give you an example of that. I had a patient that had a bullet wound, and he wasn't really sure where that bullet was. So I was like, okay, let's, put him in the x-ray, and he got an x-ray, and the bullet was I guess it was closer to his spinal cord or something like that. I think they also did a CT. Anyway, it's up to the rad on site if they want to scan the patient. In that case, they didn't want to scan him. Also, something you'll see a lot is like the BBs, and also like the shotgun, the bird shot, stuff like that. Guys go hunting, they get peppered, and they have a bunch of little BBs in their leg or something like that. So it's always going to be up to your rad. You should never have to make that decision. I'm not going to tell you what to do. Always go to your radiologist and get that approved. But if you feel something is definitely not safe, I believe, right, Gabby, you do have the choice not to scan, because sometimes they will push you to do a scan, and it's not right. So just take your time with that. So yeah, I mean, what else? What other foreign body objects have you seen? I mean, people working with
BBs, random pieces of metal that they don't even remember how they got them.
like people that were in like the war and stuff too, right? Stuff blowing up and different. And sometimes people don't even know they have metal in them. You can be scanning someone's knee and you'll see it. Yeah, which may be fine.
They're shocked.
In other situations, they'll also let you scan the patient, but if they feel like a warming, heating up, and then you
gotta stop.
Take them out. Gotta stop. Let's go number 6. Are you currently taking, or have you recently taken any medication or drug? So what do you think this one's about? Because I don't think we see that on ours.
We don't ask this question. They do get asked that if they're having sedation, although that doesn't stop us from giving sedation. So
yeah, that's a different one. We don't see that.
Interesting.
Are you allergic to any medication? That we do ask, right?
Very important.
Because in that situation, I mean, if a patient has a reaction, right, to the Gadavis or whatever, the gadolinium, whatever you're using, the next move would to give them like Benadryl or something. So believe it or not, people could be allergic to Benadryl. So that's like one situation, right?
Oh yeah, it does happen. So you don't want to be in that position where you give a patient Benadryl and they're also allergic to that.
Okay. What are we on? Number 7?
Well, number 8 now.
Oh yeah, number 8. Do you have a history of asthma, allergic reaction, respiratory disease, or a reaction to contrast, medium or dye used for MRI, CT, or X-ray examination? So let's see. I mean, yeah, they're just asking you, right, if you're allergic to like contrast, right? Is that what that question is about?
Yeah.
In that case, they would have to take a pre-allergy treatment. They want to know if you have asthma, I guess, for a heads up, right?
Yeah.
I mean, if they're used to having breathing
You're a little
problems,
more
I guess
prone.
something. Not we don't ask that question either. Not all places will ask that
No.
about asthma so much, I don't
Mm-mm.
think, right? We do ask if they, every time we ask them if they've had it. I always ask, like,
Mm-hmm.
have you had a reaction to contrast before? Have you
Yeah.
ever had it? I also, when I give them contrast, I also let them know it should just feel cool going in, shouldn't hurt. You might get like a metallic taste in your mouth. I give them the heads
Mm-hmm.
up because if if they're getting an injection and they're like, they get the metallic taste and you didn't tell them about it, I mean,
They
it's
freak
gonna kind
out.
of trip them out. Like, oh my god, they might get
Yeah.
sick and just not expect it. Okay,
Mm-hmm.
number 9. You want to take that one?
Yeah. So number 9 says, do you have anemia or any diseases that affects your blood, or a history of renal or kidney disease, kidney failure, kidney transplant, high blood pressure, liver disease, or history of diabetes or seizures? And so this one seems like a question also related to contrast.
That's right.
Since, of course, if you've got kidney failure, that's usually when we, don't want to give contrast to patients, right?
Yeah, it's all based on the facility, place you're at, the hospital. They have different guidelines. They want to check the GFR and maybe they'll half dose them, stuff like that. You always
Mm-hmm.
high blood pressure. You got to get some labs done. So yeah, it's all based on the place you're working. And also you talk to your rad and make sure you're following their guidelines.
Mm-hmm.
But yeah, typically if someone has renal failure, I don't think they want to give them any contrast.
Yeah.
If it's really needed, maybe they'll just half dose them or something like that.
Mm-hmm.
Same thing with, I think, diabetics. They're gonna want some labs. Seizures.
That's an interesting
That's an
one.
interesting one.
I've never heard
Haven't heard of that.
of seizures.
But yeah, I mean, it's cool because all you really got to do is talk to a rad. They're gonna give you an answer. Talk to the director. There's a guideline everywhere you go. There's gonna be a guideline. Okay, you want to take this next one, Gabby?
Oh,
For
yeah.
the
So
female
the next
patient.
one is really important. It's for female patients. And this form actually asks the date of the last menstrual period, which I think some places don't ask that. But I'm guessing that they're asking this just to make sure that the patient's aware that they're not pregnant. And the question after that, number 11, is asking, are you pregnant or experiencing a late menstrual period? And are you taking oral contraceptives or receiving hormonal treatment? That's also something that we don't typically see in a screening form. But I'm guessing, it's all just putting everything together to make sure that this patient is not pregnant. 13 is asking, are you taking any type of fertility medication or having fertility treatments, which again is a probability that the patient could be pregnant. So, these questions are really important because we do not scan pregnant patients until the 3rd trimester. Is that correct?
Sounds right. Sounds right. Okay.
And are you currently breastfeeding?
That's right.
Mm-hmm.
So-
Breastfeeding doesn't prevent someone from getting an MRI, but if they're getting contrast, the patient has to know that there is a small percentage that can transfer into the breast milk.
Yep. And they usually tell them to do like the pump and dump.
Yeah.
Kinda
So
thing.
yeah, they tell patients to do pump and dump if the patient doesn't feel comfortable continuing to breastfeed. Although ACR says that the amount is so low, it's like 0.01% is in the breast milk, that they don't consider it a risk or a concern at all.
Yes, and you guys, just check out the ACR guidelines and do your research on that. All right, so we're getting into the core of things. To me, this is so important, so important.
Very.
You new students, you new techs, gotta pay attention to this. The older techs, don't get lazy on this. You gotta always review it. Don't be like, looking at it when the patient's already on the table, or trusting someone that's helping you that's you think they're getting it right.
Oh, yeah. Especially if they're not MRI techs.
Yep, and that's another chapter.
Mhm.
So let's read the warning label. Certain implants, devices, or objects may be hazardous to you and or may interfere with the MR procedure,
Mhm.
i.e. MRI, MR angiography, functional MRI, MR spectroscopy. Do not enter the MR system room or MR environment. If you have any questions or concern regarding an implant, device, or object, consult the MRI technologists or the radiologist before entering the MRI system room. The MR system magnet is always on. I don't think half the patients even read that part,
Not
but
at
it's
all.
like the most important part because I
Mhm.
guarantee you, if I pull out 10 patients and I say, for $100, can you tell me if you can turn, is this magnet on or off? They're like, oh, it's off. I don't hear
That's a
anything.
good one.
Yeah, I guarantee you, we can do that tomorrow.
Mhm.
Anyway, so look, this is cool. This is like gold right here. Look at this. You guys got to learn this. You got to learn what these are. You guys always ask me, oh, what do I do? I'm a student. You guys look at the safety screening form and learn
Mhm.
what all of these devices are. This is insane. Like,
So
look how
many.
overwhelming this is as a
Mhm.
student. I didn't know half of these things. What
Yeah.
they come on, like go ahead, Gabby, just start on these, like, and kind of explain what they are a little bit, because that'll help.
So first one, aneurysm clips. If the patient's had an aneurysm, obviously that's when you should get that red flag that says, does this patient have an aneurysm clip? So if a patient tells you that they had an aneurysm surgery, then you definitely want to make sure that they don't have aneurysm clips, or if they do, you want to know where they are.
What's like a red alert to you where you're like, oh, this person might have an aneurysm clip? What's a flag to you?
If the patient says, oh, I had an aneurysm, I went to the hospital, I was out, I don't know what happened, they
Red
did
flag.
surgery,
Flag on the play.
red flags.
First down.
Oh, yeah. So those are all red flags. If a patient had brain surgery or surgery, you know, in the neck or head, and they don't remember what it was, and they tell you that they had an aneurysm, that's a red flag. So you want to make sure that this patient didn't have an aneurysm clip placed, and you will have to do some research before actually scanning that patient. You want
So
to make
like,
sure.
let me tell you, like, so what if somebody's like, I had a brain surgery, I don't know what it is, but it's fine. There's no metal in there. Are you scanning that patient?
Never, never scan a patient that says it's fine, they didn't put anything in there, because half of the time they actually don't know.
Yeah, I remember this guy, younger guy. He came out from like Wisconsin or something like that, and he's like, "Yeah, I was in this bad accident. I had a brain surgery when I was young. I don't know what it was." I was like, "Is there any metal in there?" He's like, "No, I don't think so. I don't know." So I was like, I was new too, and I was like, "No, let's CT. Get him a CT." And yeah, bunch of aneurysm
Mm-hmm.
clips all over his brain, and
Mm-hmm.
turns out the clips were safe on the 1.5. We didn't have the 3T at the time, but he did. You'll
Yeah.
be surprised that people do not even know what they
What
have
is
in their
in them?
body. You will be amazed that you tell people like, "Hey, there's, aneurysm clips in your brain." "Oh my God, I have metal in my brain." They have no idea. It's
Yeah.
insane. Insane. All right, you want to keep going?
Yeah. So next one is a big one. Cardiac pacemaker is very important to remember. That is not safe in a lot of scanners. A lot of places just don't image cardiac pacemakers whatsoever. And this is very important. This is one of those, you know, I think probably the number one most critical implant that you need to know that the patient does not have before even scheduling the patient. The patient shouldn't even be on the schedule if they've got a cardiac pacemaker.
Yeah, and I have experience with the pacemakers. I have stories where a patient went into the scan room and felt
Mm.
the magnet pull on them, and they answered all no, but they felt the magnet pull, and my pacemaker, I forgot.
Oh.
Insane. I don't know what to do about that. There's gonna there's there's things, but make sure you double check and ask them. Even though they checked all no, you gotta ask.
Mm-hmm.
There should be a script at every job. I don't
Mm-hmm.
know. Our job has a script. Some stuff that you gotta ask them every time. Have you had
Oh,
brain
yeah.
surgery? You have anything in your body? Do you have a pacemaker? You just hassle them.
Yeah.
But I have experience scanning pacemakers, so certain ones you could
Mm-hmm.
scan. But of course, these things have to be vetted, and you have to look it up. But let me give you an example of how they scan a pacemaker. So you're gonna have to have the Medtronic rep there. You're gonna have to have a nurse there. You're gonna have to monitor their heart rate, and it's just like usually in a hospital environment. So that's how pacemakers could be scanned. I mean, a lot of them can be scanned. So just know that. Yeah, Gabby, you want to just keep it moving?
Yeah. And so next implant here is a cardioverter defibrillator or ICD, implanted cardioverter defibrillator. On our forms, it usually just says defibrillator, just because it's a little simpler for patients to read and understand. And so I'm not quite sure what these look like, but we don't scan patients, or I've never had a patient who actually had one of these that was scanned. What do you think, Wami?
Yeah, I haven't came across the defibrillator. I can't really tell you guys much about it. Don't know much about that one, so we'll just keep going. I mean, we
Yeah,
can
this is
Google it
one of
later.
those. Yeah, this is one of those implants like, patient has, you need an implant card and you verify that implant and then you find out whether or not they can be scanned on that particular scanner. And following that is the electronic implant or device. So this could be a number of things, any electronic implant or device. Sometimes patients don't know the name of their implant, so they mark no to everything. But if you ask them if
That's
they've
right.
got an electronic implant or device, they probably will mark yes and
Yeah, if you
say,
hear
"Oh, well, I have this thing."
yeah, if you hear your patient beeping and you're like, "What the hell's that sound?" Oh, that's my electronic device.
Yeah.
Yeah, yeah, that's crazy. Like I heard
Yeah.
this guy beeping. Like, what
Mm-hmm.
does that sound?
Yeah.
You're beeping.
So,
Um, what's next?
so next is a magnetically activated implant or device. And
Hmm.
this is very important because when it's magnetically activated, you know that the magnet can definitely cause some
All bad.
damage.
Yeah,
Yeah.
doesn't sound good.
And that is kind of like those shunts,
Oh, really?
right? Some of those
Hmm.
are some of those magnetically activated
That's a good point.
or programmed. You know, those programmable shunts. I've heard that they use a
Possibly.
magnet to program those, which
Mm-hmm.
yeah, that's kind of scary. So look out for those. And following that, we've got the neurostimulation system.
That's a neurostimulator. You think
Mm-hmm.
they mean right there? Neurostimulator.
Mm-hmm. Neurostimulator. A
Common
lot of people
implant.
have this implant. A lot. I mean, you'd be surprised. This is one of those implants that I tend to see the most next to the
Usually, like what in the back?
yeah.
Neurostimulator. It's like
Mm-hmm.
in the back, right?
Neurostimulator, spinal cord stimulator is below that, and those two um, are kind of common. And then following that is the internal electrodes or wires. That one is not that common
You see,
unless
you seen
unless
that
they're
one before?
wires.
Eternal. And
Internal
I
electrodes.
don't
I've
think
never seen internal electrodes. But the wires, a lot of people mark yes for wires, which is
Hmm.
kind of funny because on our form it just says wires, and people say I have wires in my jaw, I have
Hmm.
a wire in my foot, I have a wire, you know,
Mm-hmm.
in my elbow, and that's usually just surgical,
Mm-hmm.
wire. And those are usually okay, but wires in our forms, it usually means the wires from the neurostimulators.
Hmm. What else you got? Bone growth and bone fusion stimulator. Now
I've
this,
seen that.
yeah,
Mm-hmm.
interesting. So yeah, you got to look
Yeah.
that up.
A bone
Co-
growth stimulator.
cochlear
Oh,
implants, ear implants, right?
yeah.
Common.
Or other
Insulin,
ear implants. Yeah.
yeah, right. Those can be tough to
To
find too. A lot of
find.
people
Yeah.
lose their card on their
Those are, yeah.
cochlear
They get those
implants.
implants when they're younger, and then they forget about them.
hmm That's another video. What else we got? Insulin or other infusion pump. Pretty common too, right?
Yeah.
You see
Pain pumps.
insulin, pain.
Pain pumps and insulin pumps.
hmm What else you got? Implanted drug infusion device. Had one of those the other day.
Mm-hmm.
Um, usually they can. Those I think they can disconnect those and they can go in.
Yeah,
Uh
like
huh.
the insulin pumps, those they usually have to wait until they're done, or like
hmm
those insulin
Yeah, they don't want to get
monitors,
off
or
that, right?
they have to make sure that they don't have that on when they come in.
What else? Implanted. Yeah, we said that. Any type of prosthesis, eye, penile implant. People have them.
Mm-hmm.
You gotta watch out.
Or even a
Um,
leg. Sometimes you'd be surprised that people don't tell you that they have a prosthetic leg
yeah.
until you.
Oh my God. Let me tell you. When I was on the trailer. This guy came on. I was like, "Hey, do you have any implants in your body? Anything?" He's like, "Oh, I got some screws in my leg." And I look at his leg. It's a whole prosthetic, like from knee to foot, a whole prosthetic. I was like, "No, you can't bring that. That thing's gonna get stuck to the machine."
Yeah.
Right? Yeah.
Mm-hmm.
Common, not
Yeah, if they're wearing
uncommon.
pants and you don't see it and they don't tell you,
Mm-hmm.
that's, you gotta be
Yeah.
very specific. That's why we have all these questions.
Crazy. We're still going through it.
Oh yeah.
Like you're gonna have to run through these questions. Some people can't read or they can't. They're slow.
Mm-hmm.
You have to read each and one of these to
Yeah, I
them
mean,
and
imagine we've gone
explain what it
through
is.
each one of these and it's taken us,
We're at
probably
like
already a few minutes
a
here.
few minutes. We're at like 27 minutes right now. And you're
And
gonna
so,
get 20 minutes to get the patient ready and scanned.
yeah, so
So
your
don't
patient,
get scared.
imagine that your patient has to look at this and go through it
I'm just
in about a
yeah.
minute.
I'm just trying to imagine this as a new patient for the
Yeah.
first. This is kind of overwhelming.
It is.
And go easy on your patients because they're looking at this thing, and most people are gonna run through it and check all no, be like I
Mhm.
don't have anything, but the people that are really reading it, they try. Don't give them a hard time. They just want to read it. Maybe they're interested because this is crazy.
Yeah.
Heart valve, common.
Prosthesis,
You're gonna see
yeah.
that a lot.
Mm-hmm.
Sometimes they're made out of like it's like a pig. They call it a pig valve.
Yeah.
Bovine makes them or what?
Mm-hmm.
Eyelid.
So,
Go ahead.
oh yeah, eyelid spring or wire.
Hmm.
Those are rare, but I have seen them,
Interesting.
and we do have to verify them because they're in the eyelid, and so, it's a delicate area.
Oh wait, did we say the other one wrong? This one's artificial prosthetic.
That's the
limb.
following one. So that's
Oh, sorry.
another one. So
Mhm.
they actually put that in its own category for
Okay.
prosthetic limb. We don't ask for any prosthetics. Usually
Mhm.
not like in categories like this.
Mm-mm.
Yeah, this is a very, very detailed list.
Metallic stent, filter, or coil.
Mm-hmm.
That's also like common, right? A lot of
Yeah.
stents and shunt.
Stents, filters, coils,
Shunts are,
shunts. Yeah.
see a lot of shunts.
Yeah, you have to make sure you verify those.
Mm-hmm. Vascular access port and or catheter, also very common for people,
Mhm.
that are,
Chemoports,
yeah.
catheters, urinary catheters. You get some patients that come in with a urinary catheter.
Watch out for the urinary catheters. If
Mhm.
you're working in a hospital, those things can get snagged on something.
Oh, yeah, you don't want to do that.
You don't want that.
Mm-mm.
That are unplugged. The
You
bag
wanna
in the
make
back.
sure you hold it in the right place and
Hang it on the side.
make sure that it doesn't have any metal also.
Oh, yep. I've seen that too. They get
Yeah.
stuck to the machine. They got a little metal clip.
Yeah,
It's like a whole
don't
big
do
deal.
that.
Nurses freaking out.
Yeah.
Radiation seeds or implants.
Mm-hmm. So
Seen
the
that too.
markers.
The markers.
Mm-hmm.
They put little markers to target where to treat them, right?
Yeah,
Radiation treatment planning.
Seeds. Mm-hmm.
Seeds,
Treatment
right?
planning.
Look at this next one. Swan Gans or thermal dilution catheter. Medical terminology.
Interesting.
Yeah,
I've never
we're gonna
heard
have to
this
look
one
that
before.
up. We're learning new things together, guys. Medication patches. Common. Those can,
Yeah, make sure you take them off.
yeah, they can get burned.
Yeah.
They have a little metal foil backing,
and that's
right?
one of those that can slip by real
Sneaky.
quick
They're
because it's not an implant, and
No.
patients don't ever mention them unless you specifically ask them if they're wearing a medication patch, which I ask them every time before entering the room. Are you wearing a medication patch? On top of everything else.
What else we got?
Any metallic fragment or foreign body, which we kind of already went over that.
We went over that. What else you got on there?
Wire mesh implant. So wire mesh, I don't know if they mean like the mesh that they use for the hernias. Yeah. Yeah. I mean, we ask patients if they have hernia mesh, although they're safe.
Yeah.
Just because that can lead to them saying more things. Sometimes if you say, oh, have you ever had hernia mesh? And they say, oh, no, but I did have surgery. And that's when they tell you that they've got something else.
Good point. Tissue expander for breasts. You know about those, right?
Yeah. So the tissue expanders for breast reconstruction. So before a patient is going to have implants put in and they need to expand the tissue, they put these tissue expanders. And I've heard that they're metal. So that's why we ask this question. So we don't image these.
I heard they will pull, so that's a no-go. Surgical staples, clips, or metallic sutures.
These are not very common. The only ones are like the sternal sutures from if they've had heart surgery. But you know, staples or clips, yeah, you don't really get those that often.
Not really. Joint replacement, hip, knee. Not like that. Those are. It's not like those are unsafe or whatever. It's just we just want to know.
Yeah.
Like if we're looking at like your pelvis, and then they see that artifact, and they're like, oh, it's just their replaced hip.
Yeah.
But if you're like, hey, do you have a replaced hip? And they're like, no, I don't.
And there's a problem.
They probably have their phone in there or something, you know? You're like, oh, damn, that's not their hip, you know? So that's why we ask. We don't want to be surprised.
Also, if they said that they
surprises.
didn't have surgery and you wrote that they didn't have surgery and you submit that saying that they didn't have surgery, and the radiologist can come back and say, hey, they obviously had surgery.
Obviously.
Why didn't you follow that? And why didn't you clarify that with the patient?
Yeah, like, okay, when the whole pandemic started, I was scanning someone's brain, and there's like this big metal artifact, like right on their brain. I was like, oh my God. And I ran in there, and it turned out to just be their mask. So, yeah. Or what else? Like, when they don't change either, and then they have like metal on their back, and they're like, what is that? Is that like their bra, or is that
or an implant? You know,
you get scared.
You get scared when you see metal in your pictures. You get scared if a patient says that they've never had surgery.
Yeah, it's crazy.
You freak out.
Yeah. Joint replacement. Okay. Bone, joint, pin, screw, nail. That's like the same thing, right?
Yeah,
like,
that's very common. That kind of, you know, it's not as bad as a joint replacement, but you know, they usually put those in the joints or in the bone. The worst ones are like the rods. If you're looking, let's say at the femur, and they've got a whole rod in their femur, good luck.
Yeah, it's all bad.
Yeah.
IUD. I mean,
we do ask them anyway, but IUDs.
Is that just because it's gonna show is it gonna show an artifact? I don't know.
No, I mean, right? Most of them don't.
Copper
there are the copper ones. But usually most places have their own policy on IUDs.
Look at this one. Are you here for an MRI?
That's interesting. Are you here for an MRI?
They're just messing with them at that point.
Yeah. Like they just went through this long list and
Oh wait,
then they
no.
ask. They're like,
Yeah,
"Oh
you
no,
get to
I'm
the
here
end.
for a
You just did all
CT."
that for nothing. Dentures or partial plates, also important.
Yeah.
If you're scanning their brain, right?
You don't want to like run a whole set of pictures and then realize that they have a removable partial or denture with metal in it, and then you have to have them
Oh,
take it
that's all
out,
bad.
and you have to start all over again.
That's gonna ruin one of your sequences. The DWI, you'll find out that's gonna ruin it, and that's an important sequence too. The DWI, for strokes.
And I'm surprised, but also braces. I mean, they're not removable, but still,
You like a heads
some
up?
screening forms do ask if they have braces.
Maybe certain braces
Yeah,
are
and
always, they
also
can go
some
in there, huh?
places, they will like suggest if the patient can wait. Like if they're getting their braces removed sometime soon, they'll just say, "Hey, can you come back
Yeah.
when you have them removed?" Because you don't want to get bad pictures.
This next one too, huh? Tattoo or permanent makeup.
Mm-hmm.
They could contain metallic stuff, right? I
Yeah.
mean, depending on the stuff the
Yeah,
makeup's made
sometimes
out
they
of.
get them done somewhere else, or they get them done at a
Yeah.
place that's not very safe. And we actually,
Contain metal.
like we've heard stories. There's patients that say, "Hey, I had permanent eyeliner done, and as soon as I walked into the MRI room, I started to feel burning." And so that's not a good sign.
Yeah. Yeah, permanent makeup, tattoos. They can get
Body
heated up
piercing.
depending, what's in that ink. Some of that ink may contain metal. The older ones for sure.
Oh,
from
yeah.
what I'm hearing.
So next one's body piercing
Yeah.
jewelry.
Yep, common.
Very common. Some people come
Piercings.
to their appointments with every piercing you can imagine,
And you test
a
it with the
lot of
magnet
jewelry.
pulls sometimes.
Yeah.
The fake stuff's gonna pull.
Yeah, you have to.
Even if it's gold, right? You tell them to take it off.
Yeah,
right?
even if it's gold, they should just take it off.
And I don't know why they bring that expensive jewelry. Like this older lady brought this medallion.
Yeah.
I don't know where, from Egypt or something, some temple. Like,
For
what are you
an
doing?
MRI. That's
For an MRI.
interesting.
And didn't want to leave it in the locker. So I'm like, come on.
Yeah, and that's another thing. Patients are putting their stuff in a locker, and they get upset. They don't want to put their stuff in there. They don't trust the place. They don't trust the locker.
Make sure they lock their things up.
They should just leave it
sure,
at home.
Yeah. Make sure they lock it though, right?
Oh yeah, make
The
sure they
key,
lock their
and
stuff
get the key,
up
because you don't want to be
and
responsible.
take the key. Yeah.
And which we're not, but you don't want to be. They're gonna ask you, why didn't you have them lock their things? Because stuff disappears. I've seen people's wallets disappear.
Oh yeah.
And okay, hearing aids, of course. You don't want to bring hearing aids in there. Or no. Not even in the doorway. I learned my lesson. Don't bring them in. They can ruin. They're expensive, right? They're like $5,000.
Very expensive.
So, and then after you tell them make sure you tell them all the things you want to tell them before taking off that hearing aid, because they're not going to hear you.
You want to screen them. You want to finish the screening form.
Yeah.
You want to ask them again.
Explain
and then
everything.
Explain everything that you're going to do. Because, once their hearing aids are out, sometimes they can't hear a thing.
It is over.
And you're trying to tell them something. You're trying to tell them to lay down, or you're trying to explain to them what you're doing, and they have no idea what you're saying.
Yep,
So.
it's pretty much done. Nothing. What else? Other implant. They're giving you another chance right there. Just tell us any other implant, right?
Any
damn thing. Just tell us.
Anything. Any other implant.
And the other one's saying breathing problem or motion disorder. That's cool. I mean, it's a lot of questions, but that's cool to know, I guess.
They include
Heads
that
up.
on there. Most places don't ask that. But some patients actually do have a breathing problem where they can't lay on their back.
And that's good to know.
And that is good to know.
Elevate
because
their head,
you will
or
have to figure out how to position them. And then a motion disorder.
Good to
that
know.
also lets you know. So patients will tell you, though, that they have a tremor. And, you can do whatever you can to immobilize them. Sometimes they self-sedate for this, too.
Yeah, you don't want to being mean to your patient. Hey, hold still. Why are you moving? I have tremors. Oh, sorry.
Yeah.
So just keep that in mind, Don't get all into it where you're like, oh, you're messing up my images and going hard on the patient. You got to assume maybe this patient can't hold still. So,
Yeah. And then under important instructions, this tells you,
go for it.
not only no implants, but it also goes over other things, other objects that people carry around with them, like their keys. It says beeper. That's kind of
That's
old
outdated.
school. Cell phone, glasses. Well, eyeglasses
Cell phone.
are usually
People
okay.
don't want to put them away, right? Yeah.
Hairpins are a big no. No bobby pins, berets. We already went over jewelry, but watches. People always forget to remove their watches.
All the time.
All the time. And sometimes, they forget they have their credit cards. You don't want them to bring that in there.
It's over.
Pocket knives.
This
happens.
That happened.
This happens.
That happened to me when I was a newer tech. Guy went in there. I was getting trained. I don't know. Anyway, this guy went in there, had a freaking pocket knife in his back pocket, and it was sliding up his back. Luckily, the other tech caught it.
Yeah.
Yeah.
That is
dangerous.
Very, very dangerous.
And I have something to say about the credit cards. When I was a student, I went to lunch, came back, had my freaking credit card in my front pocket, leaned into the machine, got wiped, went to go get gas later, didn't realize it.
Credit card didn't work.
Card didn't work. Yeah, so don't be me.
So you as a person, healthcare professional going in there, just know that you also have to remove your credit cards and your keys and your phone, especially too.
Do not carry your phone in there.
Don't bring your phone in there.
Yeah.
And then they're also talking about metal fasteners and clothing, metallic threads, which is why we tell patients to change. We just say, what, there's no exception. Although we do make exceptions when the patient is if they're paralyzed, obviously we're not going to make them change.
Or a lot of pain.
Or if they're in a lot of pain and they can't even move.
There's exceptions.
Yeah, there are exceptions to that.
Don't start yelling at the 90-year-old lady in a wheelchair.
Yeah.
You got to change. No, don't do that.
Don't do that. So, the metallic threads in the clothing can cause heating. That's in some athletic clothing. And then metal fasteners, you'd be surprised. Sometimes you can see that patients have metal in their shoes. And sometimes, the little rings are okay. But if they've got big chunk of a metal plate in their shoes, definitely have them take
steel
the shoes
toe
off.
shoes, don't do it. Even some of the ladies' high heel shoes.
Oh, yeah.
Big old nail in there.
chunk.
It'll slam against the machine. Those prescription shoes for evening out people's balance and height.
Yeah. And also braces.
Seen shoes flying there.
Therapeutic braces, all of those.
Oh, tell them about that. The clothing, the Lululemon. Oh, you say Lululemon? Athletic
the Lululemon
gear.
Brand clothing, athletic gear. That was actually one of those brands that had the metallic threads that were heating up and burning people. So we just tend to ask patients, are you wearing a Lululemon?
Yeah. And
when they can't change. If they can't change, they're in too much pain and they're just wearing leggings and they say, oh, well, they're just cotton. And you say, well, are those Lululemon brand?
And they're going to know because those are they're kind of more expensive, right?
Yeah, they're pricey.
They know what they're buying.
But they should say, no, they're just cotton. They're from Walmart or Target. And
that's the thing that's crazy about the progression of athletic gear. It's starting to have all this different kind of materials and we're gonna have to just be looking out. What else do we have? Anything else on there?
So there's a note that says you may be advised or required to wear earplugs, although it's actually a requirement. I'm surprised that it says advised. Because it is a requirement to wear earplugs or other hearing protection during an MRI.
Even
if you're in there with someone else.
Even if they're deaf or whatever, took their hearing out, I still give them.
Oh yeah. So even if they're deaf or have, they say that, oh, I can't even hear anyway. I don't need them.
Doesn't bother me or something.
Doesn't bother me. No, you always have to give hearing protection. Always use earplugs or the earmuffs because whatever hearing they do have or whatever ear function that they do have can be damaged still.
And then you don't want to get called in the office. They call and complain, hey, you didn't give this guy earplugs? Oh, he didn't want it. Oh, they're not
No,
going to buy that. So
never. It's
eh,
very loud in there.
it is.
Very. So if you're
Mhm.
becoming a tech, and eventually you'll find out how loud it is.
Yeah.
It's very loud.
And just let your patient know when you put them in there, you give them that call button, like squeeze this ball if you need me for any reason.
Mm-hmm.
There's times patients have gone in. I've heard, no headphones, didn't say anything the whole time. But I always communicate with my patients saying if there's any
Yeah.
issues, you squeeze this ball, don't hesitate.
Yeah.
Don't,
That's
you know what I mean?
that's
Don't.
also why you have to talk to the patient when they're in the scanner
Mhm.
while you're scanning them, because you'd be surprised sometimes, they're too cold, or you know,
Mhm.
or let's say you did forget to give them earplugs, which you don't want to do that, but let's say you forgot to give them earplugs or the headphones,
Mhm.
they'll tell you. So
Yeah.
always check in on them. Usually after the first, the first set of images, the localizer, you just check in on them, say, hey, you doing all right?
All right. So yeah, do you want to add anything else? I guess we just ran through the whole screening form, right? I mean,
Yeah. I mean, that's pretty much it. But
that's in Spanish,
like
right?
after you have them fill this out,
Mhm.
you still ask them these questions. I mean, obviously not every single one,
Mhm.
but before you let them in the MRI room, into the scanner room, you ask them one more time. Say, okay, we already went over these, but I just want to make sure that you answered no to everything. You don't have any removable devices or medication patches.
Mhm.
Never had brain or heart surgery. No jewelry. No bobby pins. That's usually like the questions that I ask. And no other surgeries that were not on this list. No other implants that were not on this list.
Yeah, that's great. That sounds great.
Yeah,
All right. I think we're going to wrap
that's
this
about
up,
it.
huh?
Mm-hmm.
So yeah, you guys, this is a great video. Share it to any new techs or students. I highly recommend that the students check this video out.
Mm-hmm.
We will catch you guys on the next one. As I said, Thursday and Fridays we dropping videos. Also doing some live streams. I got over, I don't know, almost 90 videos on my channel. Comment, like below. We'll catch you guys in the next one. You want to say bye
All
to them?
right, guys. Thanks for watching.
Peace.